Hello, everyone. My name is Evelyn Flores Serrano, and today I will be presenting on the hepatitis A virus. I will be walking you through its classification, how it's transmitted, the disease it causes, how we diagnose it, treatment and prevention, and finally, some recent findings about the virus. So, to start off, what is hepatitis A virus? Hepatitis A is a highly contagious liver infection. It is caused by the hepatitis A virus and can range in severity from a mild illness to a severe, long lasting infection. Hepatitis A is typically spread through the ingestion of contaminated food or water or through close contact with an infected person. Next, classification and structure. Hepatitis A belongs to the family Picornaviridae and the genus Hepatovirus. Structurally, it's a small, non-enveloped virus with an icosahedral capsid about 27 to 32 nanometers in size. Its genome is single-stranded, positive-sense RNA, about 7.5 kilobases long. One of its most important features is stability. It can survive acidic conditions in the stomach, resist bile in the liver, and even remain infectious after freezing or drying. Next, transmission and source. The only natural reservoir for hepatitis A virus is humans. Transmission occurs through the fecal-oral route. This means people get infected by consuming contaminated food or water or through close personal contact, such as in households or child care centers. Shellfish from sewage polluted waters are another common source. Prevention relies heavily on good hygiene like hand washing, access to safe water, and most importantly, vaccination. Prevention is centered on hygiene and safe water supplies. Washing hands with soap and water and avoiding raw or undercooked shellfish are important measures. In addition, vaccination is highly recommended, especially for high-risk groups, for people who have been recently exposed, post-exposure prophylaxis with the vaccine or immune globulin within 2 weeks can help prevent illness. And here on this slide, I just have a diagram of how hepatitis A can spread and certain measures that can help prevent the spread of hepatitis A virus. So next, disease. Hepatitis A. Hepatitis A primarily infects liver cells or hepatocytes. Interestingly, the liver damage is not caused directly by the virus, but rather by the immune system attacking infected cells. Symptoms include fever, fatigue, nausea, abdominal pain, jaundice, dark urine, and pale stools. The incubation period is fairly long, averaging 28 days but ranging from 15 to 15. One important feature of this virus is that it can be shed in feces 1 to 2 weeks before symptoms even appear. This means asymptomatic individuals can spread the disease without realizing that they are infected. In children, the illness is usually mild or even asymptomatic, but in adults, it can be much more severe. And mortality is low overall, but higher in older adults or people with pre-existing liver disease. And on this slide, I have a picture of the signs of hepatitis A. Next, diagnosis. To diagnose hepatitis A, serology is the most common method. If a patient tests positive for IgM antibodies, it indicates an acute or recent infection. These antibodies appear early and usually remain detectable for 4 to 6 months. IgM antibodies, on the other hand, show past infection or vaccination, and they provide long-term, possibly lifelong immunity. Molecular testing like RT-PCR can detect hepatitis A virus RNA in blood or stool, but this is usually reserved for outbreak investigations rather than routine diagnosis. Finally, it is important to distinguish hepatitis A from other types of viral hepatitis, such as hepatitis B, C, or E, since the clinical presentation can overlap. And on this slide, I have a hepatitis A virus rapid test, and it shows the test for IgM and IgG. So next, treatment and prevention. There's no specific antiviral treatment for hepatitis A. The infection is usually self-limiting. Supportive care includes rest, proper hydration, balanced nutrition, and avoiding substances that stress the liver, such as alcohol or high doses of acetaminophen. The most important prevention tool is vaccination. The inactivated hepatitis A virus vaccine is given in 2 doses, 6 months apart, and it's highly effective. About 95% protection after the first dose and almost 100% after the second. Both natural infection and vaccination provide long-term immunity, possibly lifelong. And on this slide, I have a flyer from the CDC that says protect their tomorrow today, vaccinate against hepatitis A, since the CDC recently did a research on hepatitis A virus outbreak, and it showed that this outbreak is happening most commonly amongst homeless individuals. Right. Lastly, new data and outbreaks. So, finally, some recent findings tying back to the last slide. According to the CDC surveillance data, the US has seen a significant increase in hepatitis A outbreaks, particularly in populations experiencing homelessness or using illicit drugs, which I did mention on the last slide. And another recent study done by The Lancet found that hepatitis A virus can remain infectious in frozen fruit for over a year, which raises several concerns about large-scale foodborne outbreaks linked to items such as berries and shellfish. These findings highlight the ongoing importance of prevention and vaccination. And on this slide, I have a chart by the ABC News of hepatitis A outbreak cases state by state. All right. Thank you so much for listening to my presentation on the hepatitis A virus. And this is my works cited page. Thank you.